good evening, everyone. Hi, my name is Mr. Alan. I'm here again for you tonight, everyone. It's our Facebook Live every Thursday. And of course, we have prepared questions for you for nursing, prioritization, and delegation. Okay, so before anything else, I would like to welcome some people and give a shout out to the following. Okay, so we have the following people who came in early tonight. So we have Jamila, um, Bano, Jennifer, Marie, Griggs, Aida Wendam, Ferolin Galeno Possession, Nimco Coca-Cola, Kadiato Trawali, Nimco Coca-Cola, Jamila Bano, of course, um, Carlos Cañas, Jet Vidal. Okay, we also have Del Tacon. Okay, Abarcama Aurora, Denise Germain, Carrie Ann Gordon. It's really a lot of people, guys. So I'm just gonna have to mention the first 10 who came in tonight. Okay, Banji Laron, Evelyn Cuiva, and then I'm gonna have to do some more shout out later on, everybody. Or you can send me a message that you want to shout out. So there are some familiar names in the comment section, everyone. Okay, but anyway, so let's start. Hope everybody can hear me. My name is Mr. Alan Matus, and I am the nurse educator for this Facebook Live session. I have been a nurse educator for more than 25 years, and I have been an NCLEX instructor as well. So at this time, I'm also a nursing faculty in a nursing program, and I help nursing students pass their NCLEX. So I've been teaching NCLEX for almost 25 years, and of course, I am the founder and the founder of Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. Okay, and of course, as everybody knows, I also have a published book in Amazon. Okay, so I have my book, and of course, it's also available in the Philippines right now. You can email Matus Nursing Review Academy at gmail.com if you're interested also to purchase in the Philippines in black and white color. Okay, all right. So, okay. So let's now go to our agenda for tonight, everyone. I think we have some nice comments from our what's this? From our students here. Okay. So what's our agenda? Our agenda for tonight will be, of course, we'll be having some questions on prioritization. We actually included one clinical skill like last week, and then maybe next Thursday, you better be here because we're gonna be tackling a little bit on dosage calculation. I think everybody's excited about dosage calculation, so we'll be having one or two questions next week, especially involving pediatric medications that includes calculating medications or dosages for children. Okay, usually that is a common challenging concept for students taking the NCLEX, the dosage calculation involving body weights. Of course, for tonight, we're gonna have our agenda. Okay, so we have our motivational photo of the week. So this was sent to us by Kay. So Kay, of course, in the photo is the workbook and of course my book. And also, just remember that the workbook and the book has the same content. Okay, it's just really a different format. So if you're watching the online academy, my videos, my lecture, then you can use the workbook to write on. And usually when you order the workbook, I send a bookmark. I send a lot of special messages. So I'm very excited for Kay. She was our student in the ILPN program or review program, and now she is reviewing for the RN. So hopefully she will also pass the RN program. So thank you very much, Kay, for the photo that you sent to us. And she also shared this in other Facebook groups also. So thank you very much. Okay, so special announcement before we go to our questions. On January 30 to April 3, we're starting another session of our 10-day live comprehensive NCLEX review webinar. So that's going to be every Saturday from 8 to 4 p.m. and that's a Saturday class. Part of this webinar is that, of course, there's a live review, okay, and then also you'll have access to all the lectures online for 6 months since you enroll. It comes with a workbook. It comes with access to our online academy that includes quizzes, that includes predictive exams, and of course, you can always ask me questions when you're enrolled in the program. So we're very excited to start our next session, and that will be on January 30. So if you need more information about that, everyone, you can visit our website www.matusnursingacademy.com. Okay, matusnursingreviewacademy.com. That's for the online class. Okay, all right. So another one, of course, for tonight, we're gonna have our, of course, our raffle again for the free 90-day online access NCLEX review. So after this program, stay tuned because we're gonna be drawing the winner for the free 90-day online access NCLEX review. So if you make a comment in the comment section, we will be included in the pool. So let's see, and then we'll post the winner and the video of whoever wins tonight's 90-day online access. Okay. Another one we have, of course, if you have time right now, if you can share this, or if you're watching the YouTube video, then you can click also subscribe so that you can always get the most updated videos that we have for the Facebook Live on nursing prioritization and delegation. So what are you waiting for, everyone? So please click share, or please click subscribe also, because you want to help your friends as well. Okay. All right. So another one. Okay. So I'm gonna ask everybody, are you ready to, okay, are you ready for our first question for tonight? So thank you very much, Ursula, for your recommendation. I really appreciate that. Okay. And then, of course, for tonight, we have a lot of people who just came in. So we have Menchi. Hi, Menchi. How are you? This is our student. Okay. Our super fan also. Jane. Hi, Jane. How are you? Okay. Flo Quarting, Celia, Jeffrey, Anya Wira. Okay, also. E. Francis Kim. Mai. How are you? I just had a chat with you today. Hi, Fernando. Our students in the 10-day live NCLEX review are all here. So thank you very much, everybody. Ja Ricardo, Lisa Sibayan. Hi, Sally. How are you doing? My awesome student, also Sally. How are you, Sally? Kikil Barker, Nell Roma, Julie. Some of these people actually already passed their NCLEX, so they're still attending. We have Crystal Gianzon, Kay Pasang Lama, Shiny Sipovida Andrino, Joanna Manalang, Alicia Riz Ngufor. So I'm really very sorry for the other people if I was not able to give you a shout out. So maybe later on, everybody, so keep commenting, okay? All right, so let's have our first question for tonight, everyone. Our first question is going to be on prioritization. It's going to be a straight to the point question. Of course, the same situation, you have 4 patients, and then which patient are you going to see first? Okay, so this both applies to the NCLEX-PN and to the NCLEX-RN examination. So let's see, everybody. Okay, all right, so get ready, everyone. This is your question. Okay. So the nurse makes rounds after the end of shift report. Which client needs immediate intervention? Okay. A, the 44-year-old client who has more than 6 premature ventricular contractions after a recent myocardial infarction. B, the 28-year-old client who has severe excruciating pain in the abdomen, lower back, and groin due to kidney stones. C, the 54-year-old client who complains of eye pain and blurred vision due to cluster migraine headache. Or D, the 47-year-old client who reports red urine after taking phenazopyridine for urinary tract infection. Okay, again, the nurse makes rounds after the end of shift report. Which client needs immediate intervention? A, the 44-year-old client who has more than 6 premature ventricular contractions in a minute after a recent myocardial infarction. So letter A here is 6 PVCs in a minute. So there's a missing word there. That would be 6 PVCs in a minute. Okay. Letter B, the 28-year-old client who has severe excruciating pain in the abdomen, lower back, and groin due to kidney stones. C, the 54-year-old client who complains of eye pain and blurred vision due to cluster migraine headache. And letter D, the 47-year-old client who reports red urine after taking phenazopyridine for urinary tract infection. Now you will see that we have for A, B, C, and D, I am going to tell you that we have patients having problems here. All these patients, or most of these patients, need attention. But which patient do you think really should be coming first? Which one really needs to be addressed first? Okay. Which patient needs to be addressed first? Of course, are you going to address first the PVC? Are you going to address the the excruciating pain, or are you going to address the eye pain and the blurred vision? So you have to find out which patient here is in danger. Okay, which one is a safety issue? Is it A, B, C, or D? Everybody. Okay, so which means to say that you need to know your content here. You know, you have to go back to your content and then you apply that into the situation. So, okay, so let's see, everyone. What's your answer? A, B, C, or D? Okay. The question also is that with phenazopyridine, you know, what is that? You know, you have a red urine after taking that medication. So is that expected, or is that something that indicates a complication also, or a reaction? So be aware of that, everyone. So which one comes first here? You know, eye pain and blurred vision, excruciating pain. All right. Letter A, B, C, or D. So let's see. Okay, so what's your rationale, everyone? So let's see. All right, so the answer to this question, everybody, will be, okay, so let's see what's going to be the answer to that question. I think that most of you have already placed your answer. So some of you answered letter A, but I want to find out why you answered letter A, everyone. So how can that be a serious situation, you know, compared to letter B? Why letter A? So I would like to find out, right? But anyway, the answer to that question, if you have given your answers already, everyone, is going to be letter A. Very good, everybody. So that would be letter A. Now, why is the answer letter A? You always have to go back, you know, to your basic concept or content. After a myocardial infarction, there are several complications that may happen. You can have acute heart failure. You can have ruptured ventricular myocardium. Okay, there's other complications. You can even go into cardiogenic shock. But one of the complications or outcomes of myocardial infarction because of damage to the ventricles of the heart or the muscles of the heart is going to be the presence of premature ventricular contractions after a myocardial infarction. So you will have PVCs after a myocardial infarction. However, not all PVCs should be reported right away. There are signs that PVCs are dangerous after a myocardial infarction. Now, one of the things that you have to remember is that your PVCs, if they're dangerous, they can lead to unstable ventricular tachycardia, or they can lead to the most life-threatening arrhythmia, which is your ventricular fibrillation. So remember that your PVC can lead into unstable ventricular tachycardia or ventricular fibrillation. So the question is, what are the signs that the PVCs are dangerous? Number one, it's going to be if you have 6 or more PVCs in a minute. So take note of that. 6 or more in a minute. Number two, if you have PVC that is every other beat is a PVC, that's also a dangerous PVC. Another one, if you have 2 PVCs in a row, 2 PVCs in a row, then you also have 3 or more PVCs in a row. So again, I'll repeat, more than 6 PVCs in a minute. You have every other beat is a PVC, sorry. Every other beat is a PVC, or you call that by Gemini. Number 3 could be 3 or more PVCs, or 2 PVCs in a row, or couplets, sorry. And then 3 or more in a row as well. And then also, it's a dangerous PVC if it's multifocal. And then also, if the PVC falls on the T wave, okay? The R wave falls on the T wave, that's a dangerous PVC. So I'm just gonna have to repeat. Again, it's a dangerous PVC if it's 6 or more PVCs per minute. If you have every other beat is a PVC. 2 PVCs in a row or couplets. 3 or more PVCs in a row. Multifocal PVCs, meaning there are many sources of the impulses that stimulate the myocardium. And lastly, if the PVC, the R wave, falls on the T wave, you know, this can lead to lethal arrhythmias. I know that this is a concept that's kind of like hard to understand, so read more about it, everyone. Especially when you talk about arrhythmias and EKG, a lot of students, that's their weakness in the usually in the NCLEX. So just remember that PVCs may be harmless, however, you have to monitor for dangerous signs. Okay. Now, so that's the answer is going to be letter A because we need to report that immediately and do some interventions. Now, for your letter B, everybody, that's also a priority, severe excruciating pain, that's pain management. But is a patient going to die immediately with letter B? Not really think so. So letter B is, of course, a priority, but A comes first. Your letter C, the 54-year-old client who complains of eye pain. Remember, when you have cluster migraine headache, a characteristic of that would be eye pain and blurred vision also. So that's a manifestation of the disease. You need to address that, of course, pain management as well, but B and C are not as important as letter A. All right. Your letter D is, go back to your content. Letter D, phenazopyridine with your brand name Pyridium. It is a urinary analgesic, usually being given for patients with urinary infection to reduce the pain, to reduce bladder pain. And a common side effect of your phenazopyridine is the orange and red color of the urine, which is expected, the discoloration. So that's why letter D is normal. There's nothing to be worried about that. So that's why what comes first is going to be letter A, everyone. Now, regarding EKG, I have a full discussion of that in the online academy, actually, and we do also have quizzes on EKG in the online academy, as well as with photos and pictures and images. Okay, so just remember that, everybody. So let's have some reaction or comments. Okay, EKG is really difficult. Okay, so let's see. So don't forget that concept, everybody. Okay, so very good. All right, so most of you got the answer letter A, but then also what's important is also letter A, remember that after a recent myocardial infarction as well. So the fact that it's recent, right? So that could be another clue also there. Okay, all right. So very good. Hopefully you learned something from that, everyone. Let's go to, okay, another one, everybody. Okay. All right, so somebody mentioned actually, so MJ said ventricular tachycardia, which is exactly correct, that when you have dangerous PVCs, it can lead to ventricular tachycardia. Okay, very good. So number 2, everyone. The registered nurse works with a licensed practical nurse in caring for clients in the medical surgical nursing unit. Which of the following actions by the LPN requires further intervention by the RN? So this is a negative question, everyone. When you say negative question, we're looking for something that is wrong, which is the answer. So which action by the LPN requires further intervention or reinforcement? So the RN should intervene. A, cleaning the tracheostomy site once per shift and as necessary. B, administering pancreatic enzymes 30 minutes after breakfast. C, performing colostomy irrigation 1 hour after meals. D, stopping the tube feeding for 2 hours before giving phenytoin suspension. E, applying suction while inserting the catheter during suctioning. Okay, so let's repeat. The registered nurse or RN works with the licensed practical nurse or LPN in caring for clients in the medical surgical nursing unit. Which of the following actions by the LPN requires further intervention by the RN? Select all that apply. So again, this is a negative question and you have to slow down a little bit because we're looking here for the wrong action by the LPN, which is the answer. Okay? Okay, so A, cleaning the tracheostomy site once per shift and as necessary. B, administering pancreatic enzymes 30 minutes after breakfast. C, performing colostomy irrigation 1 hour after meals. D, stopping the tube feeding for 2 hours before giving phenytoin suspension. Or E, applying suction while inserting the catheter during suctioning. We do have a question in the, okay, let me see. We can have that later on. We do have a question from one person. Do we get EKG interpretation questions on PN NCLEX? Okay. Now, usually the EKG would be for RNs, especially complex concepts like that. But I've heard from some students who took the LPN the NCLEX-PN, that they did have some EKG also. I think it was just really very basic EKG. So yeah, so I'm not gonna say that you're not gonna have it, but then I think it will not hurt if you just know at least the basic EKG, not even the advanced EKG, just the core content, what EKG is all about. Okay, because you have to remember that NCLEX is testing you as a brand new nurse. NCLEX is not testing you as an experienced, uh, totally an expert on EKG, in and out. So just really learning basic EKG, the photos or the images, how it looks like, and also what they mean, and what are some of the safety issues about EKG. Especially the implications of the different types of arrhythmias. So just be aware of that, everyone. Okay. All right, so we have, okay. So what will be the answer, everyone? So we're looking, so the question again is requires further intervention by the RN. So meaning that, so here in select all that apply questions, I always tell students the technique is either true or false, each item. So in order to be successful in answering select all that apply questions, you need to have a very strong content. Okay, very strong content so that you can eliminate its option. So it's really going back on the most important concepts again that you need to know. Okay. All right. So I hope everybody has given their answers. Okay. If you have more questions, everyone, you can post that in the chat box also. You can do that. All right. Okay, so hopefully everybody has given their answers. Now it's time for us to have the answer, everyone. Okay, so are you ready for the answers, everybody? So we do have, hi Arlene De Rosas. Hi Arlene, how are you? She's watching also, and Arlene actually passed the NCLEX-PN already. Okay, very good. Where's my Facebook testimonial? Okay. All right, Kimberly Perrin. Hi, Kim. How are you? She's in our Tuesday class. Katleya Espiritu is also watching. Alwex Imafranca, Nerissa Rancapero. Okay. Oh my gosh, my clinical instructor is here also. She's watching right now. Mishibum Antonio, I'm gonna give you a shout out. Okay. All right. So a lot of familiar people in this class. Okay. And thank you very much for my clinical instructors. I'm always very grateful for my instructors in college, big time, because we were just young kids, and then the role of clinical instructor is always to mold the students, and of course they become something else. So the same thing, my philosophy with my students is that I always believe in the potentials of my students. You don't really know what they become later on as well. So yes. Okay, so let's proceed, everyone. So the answer is going to be very good. So you have your letter B, and then you also have your letter E, everyone. So requires further intervention is an example of a negative question. Okay, negative question means that you're looking for the wrong options, which are actually the answers. Now, letter A, cleaning the tracheostomy site once per shift and as necessary, that's actually correct. We at least clean the trach site once per shift and as necessary. Also, another one, so your letter B. Okay, let's go to letter B first. Pancreatic enzymes 30 minutes after breakfast, that would be incorrect because we're supposed to give pancreatic enzymes with snacks or meals, or also before meals as well. Okay, now your letter E, applying suction while inserting the cath during suctioning, that is wrong because you're not supposed to apply suction while inserting the catheter. You apply suction intermittently when you're removing the cath, while twirling it in your fingers or rotating the suction catheter in your fingers, with your fingers. Okay, so E is a safety issue, you never do that. And then letter B also is a wrong timing of medication. Okay, that's being given by the LPN. So B and E will be the answer. Now, your letter A, as what I have said, is okay. We do that. Letter C, performing colostomy irrigation 1 hour after meals. That's correct. Colostomy irrigation has to be given or has to be done 1 hour after meals. So study your colostomy irrigation before your NCLEX, everyone. And also remember that we irrigate colostomy, but we do not irrigate ileostomy because it's liquid. So remember that, everyone. So 1 hour after meals, Letter D, stopping the tube feeding for 2 hours is still a relevant practice, before giving your dilantin suspension to ensure absorption. So it's either 1 to 2 hours before giving, you stop the tube feeding, and then you resume or stop the feeding up to 1 to 2 hours after giving dilantin as well. So remember that, everyone. Okay? All right. So letter D, don't forget the concept that tube feeding may affect the absorption of your phenytoin sodium or your dilantin, and that's why we stop the tube feeding in some facilities. You have to check the policy and procedure. That would be 1 to 2 hours before giving suspension by tube feeding, and then resuming the tube feeding again after like 1 to 2 hours after also giving your phenytoin sodium. So maybe you don't know that, so be aware of that, everybody. Okay, so the answer is going to be B and E. All right. Okay, so very good. So thank you very much, everyone. So I hope you got that question very well. Okay, like correctly. So we have Sabina Yawali, who just came into also. Now I do have what's this? I do have another question for you also, everybody. The next question that we will have is going to be more about clinical skills. Okay, clinical skills. You do have those in the NCLEX. Will be asked about questions on like how do you sequence the clinical skills. So some of the most common clinical skills in the NCLEX will be tracheostomy suctioning, colostomy bag change or colostomy care, Foley catheterization, both for male or female, postmortem care, administration of meter dose inhalers, eye drop medication, ear drop medication, hand washing. So you really have to review all of those skills. Usually, my advice to students is review the skills as they near the NCLEX examination so that they don't forget the skills for the NCLEX. Okay, so review your skills. Don't forget that because you do get these kinds of questions, everybody. Okay, all right. So let's have the next question, everyone. Okay, so thank you very much. Well explained. Oh, thank you very much. Okay, thanks. All right, pancreatic enzymes. Okay, so we'll answer some of your questions later on for pancreatic enzymes, everyone. Okay, now let's proceed to your next question, everyone. Okay, so place the following steps in order when performing Foley catheterization in a male client. So I'll be slowing down a little bit because I know that this is a question that will take a little bit of your time to analyze. Okay, all right. So read the question and arrange in sequence, everyone. Okay. So one, do you open the supplies kit and apply lubricant to the catheter tip? Number two, place on supine position with the legs abducted. Three, inflate the balloon slowly using sterile water. Four, insert the Foley catheter through the urethra. 5. Secure the catheter to the client's thigh. 6. Clean the meatus using circular motion. Or 7. Verify the order and gather supply. So you have to put them in order. Okay? Okay. So I'm giving you a little bit of time to answer this because I know that most of you are, this is a challenging question, definitely. Now, one of the things that I want to tell you is this, that in some facilities or using evidence-based practice, some books do not recommend anymore that we check the balloon before inserting the Foley. We used to do that, like inflating the balloon just to kind of like check. But some facilities or some evidence-based practices no longer recommend that. So sometimes you may not see that probably that we don't inflate the balloon anymore, okay? Just to check it before inserting your Foley catheter. So what do you think is the sequence for this procedure? Okay, so we do have answers in the chat box already, okay? Or in the inbox. I would like to give a shout out to Darlene Pierre. Hi, Darlene, how are you doing? Okay. Guadalupe Gomez also. Thank you very much for being here tonight. Also, Nerissa Rancapero, Raquel Manlapig, Akudo Ikeyagu, Anime, Maria Denise also, Manjinder Kaur. Hi Manjinder, how are you doing? Pushpa Pandi, Rosa Caroline, Modo Genevieve, Ramata Dumbia. Okay, Queen Choma, Milahi. Okay. We also have Cherise Guevara Hilado. We also have Jocelyn Beltran Monastrial and Lini Pascua, Maureen Cortez, Angeline Choi, Marie Gerard Lauchur, Justin Dizon. Hi, Justin. How are you doing? Femi Okonlola. Okay, and Deborah Thompson is also here. Okay, so hopefully all of you have given your answers, everyone, and verified your answers. So what's the technique for answering skills questions in the NCLEX? Well, what you're going to do, everyone, is this. Always remember what are the standard steps that you always do before you go inside the room of your patient. Okay, so before you enter the room of your patient, what are the standard steps? Okay, so what are those? You need to know them, and then of course what are some of the safety issues that you need to remember. Okay, so what is the answer to these questions, to this question, everyone, about this skill, Foley catheterization? And then don't forget that's a male client. Okay, so and then you will notice also the position for the male client is supine position with legs abducted. For females, the position could be dorsal recumbent position, okay, with the legs abducted also. So the answer for this question, everyone, hopefully my answer key is correct. Okay, that would be, let me see if we have the same. Okay, very good, everybody. Okay, so I'm very happy we have the same answers, everyone. So the first one that comes first, always, is always verifying the order. Okay, verifying the order, making sure that it's the right order for the right patient. Okay, it's not enough to see that the order is complete, but you also need to make sure, is it for the right patient? Is it for the patient who has relevant diagnosis? That's the reason why the order was given. And then you have to gather your supplies. And then after that, number two, you place the client on supine position with legs abducted. So number two. But then when you enter the room of the client, you have to wash your hands, of course, and then explain the procedure. And then after that, really identify your patient. Very sure, important, by checking the ID band. And then place the client on supine position with the legs abducted. All right. Then number one comes next. Open the supplies kit, you prepare everything, and then apply lubricant to the catheter tip. And then number six is next. You have to clean the meatus using circular motion for the males. Next will be number four. You have to insert the Foley catheter through the urethra. Of course, the penis must be perpendicular. Remember that. Okay, or right angle. And then number three comes next. Inflate the balloon slowly using sterile water. And then number five, which is secure the catheter to the client's thigh. So that's the answer. Yeah, sometimes you can say also privacy provided, definitely. So that will happen after you explain the procedure and get the consent. Then you have to provide privacy. That's really very important as well. And then one thing I remind students also, Foley catheterization is an invasive procedure. So always remember, even if your patient gave consent, but in the middle of the procedure, the patient becomes uncomfortable, it is an alert patient, and the patient wants you to stop, you have to remember that you have to listen to your patient, and the patient has the right to refuse, the procedure. So just remember that. And then also, if you're inserting the Foley and then there is obvious resistance and it's really very hard to insert, then maybe you should not keep on going because you may cause physical damage. Okay, so just remember that, everybody. So review your Foley catheterization for male and female. If there's one procedure that's really very common, when you start practicing as a nurse, that would be inserting your Foley. Okay, and always remember that you have to stick to reviewing the evidence-based practices as well. What are the recent practices that we don't do anymore? Okay, all right. So thank you very much, everyone. I hope you learned something from that. So let's go now to the last question, everyone. So again, for next week, everybody, I'm reminding you that we may have a dosage calculation question. So please review ahead of time so that we'll have a great time next week. Okay. All right. So does the Foley catheterization requires a consent for every procedure, especially this is invasive? You need the consent of your patient, and that's the reason why you have to explain the procedure. Okay. So that needs a consent. All right. Consent verbally from the patient, of course. Okay. All right. So next you have, so okay, so let's proceed. Okay, so just gonna give you a shout out also if we have any new comments. So Gian just came in, Abidemi Sola also come in, and Freda Villanueva. Okay, Jerty Silvestri, hi, welcome here also in our Facebook Live tonight. Okay, all right, so let's proceed to the last question, everyone. The last question is going to be delegation. Last week, the delegation was for LPNs. For tonight is going to be delegation to the UAP. And I think most of you are doing well with delegation, and that's why I'm only giving once a week for now. Okay? So the last question, everybody, let's have it. Okay? So let's see if you can answer this question on delegation for the NCLEX. Okay? All right. So let's proceed. I will read the question. All right. Hello, Ojikuk Chukwo Kion Wusi. Thank you very much. If you can also let me know from which country are you coming from, guys. Okay, I would like to find out. Are you from Nepal? Are you from Nigeria? Are you from Philippines? Are you from UK? Saudi Arabia? You know, we're international. Always remember that. Okay, so the registered nurse or RN works with the unlicensed assistive personnel or UAP and licensed practical nurse or LPN in caring for a client who had a left leg cast application. Which of the following tasks can be delegated to the UAP? Select all that apply. A. Reposition the client every 2 hours to promote cast drying. B. Check the client's ability to wiggle his toes. C. Report any changes in the color of the toes. D. Place the bedpan under the buttocks to assist in defecation. E. Ensure that the call light is within reach of the client. And letter F. Administer diphenhydramine orally for itchiness. Okay? All right. So read, everyone. Okay. So that's from Hawaii. Very good. So while you're answering, everybody, let's have a shout out. So we have from California, that would be Gian Torres. Actually, Ferulin Posicion is from Saudi Arabia. Thank you very much for being here. We also have from Nigeria, Oje Chukwo is from Nigeria. Okay? All right. Manjinder is, okay. All right. Maureen is from Philippines. Okay, so as I told you, everybody, you have to stay over after this. After this, we're gonna be drawing the winner of our 90-day free online NCLEX access. Okay, Joyce Jamila Flores is from Saudi Arabia also. So thanks for being here tonight. Okay, so let's see. Okay, what's the answer, everyone? Okay. Manjinder Kaur, California. Okay, very good. Don Kui from Arizona. Okay, all right. Charisse Helado is from Dubai. Okay, so you have your answers already, everyone. Okay. So what is the technique in answering this question? Always remember, you have to know the scope of practice of your UAP, everybody. Okay, or let's say your nursing assistant in this case, for example. Okay. So the answer for this question, everyone, okay, you should be able to get the right answer for this, huh? So the answer is going to be letter A, C, D, and E, everyone. A, C, D, and E. So number one, letter A, reposition the client every 2 hours to promote cast drying, of course, okay? Letter C, report any changes in the color of the toes. What you mean by reporting there will be report to the RN, you know, so, well, of course, the nursing assistant, if she notices something is wrong with the toes of your patient, you know, the color, then she needs to report that. That's part of her scope of practice, to report any change of condition, okay? It doesn't mean that she's wrong, but if the nursing assistant thinks that there's a change in condition, then she has to report, okay? Letter D, place the bedpan under the buttocks. Of course, that is activities of daily living, so that's letter D. And letter E would be ensuring the call light is within reach. That will be for the, of course, for the UAP as well. Okay, now your letter B, checking the client's ability to wiggle the toes. That would be the responsibility of the RN. That's assessment. Remember, we do not delegate EAT, evaluation, assessment, and teaching. Am I right? So evaluation, assessment, and teaching, because those are complex responsibilities. Letter F, administer diphenhydramine orally. That would be something that you can give to the LPN, because that's an oral medication. Okay, so the answer is going to be A. That would be letter C, D, E. Okay, repositioning is okay here. This is not an unstable patient. This is just a patient having a left leg cast. Okay, it's not a hip fracture patient, everyone. Okay, so that would be A, C, D, and what? And E. Okay, so that's the answer, everybody. Reporting any changes, of course. What you mean there is reporting to the RN. Okay, any changes in the color of the toes, not reporting to the physician. That's a responsibility of the RN to report to the physician, everyone. Okay, all right. So let's proceed to K. So thank you very much, everybody. So before we end for tonight, okay, so we have in our stream, okay, so just announcing to everybody by next week, okay. So on Monday, only 3 days, everybody, we also have again our promo, okay. So we have our 50% off for our program, online program, the self-study comprehensive online. So this 50% off only applies to the self-study program, not the live webinars, okay. Also, we have a discount for our workbook. That would be 30% off for the workbook, so only $66 instead of $94.50. And then for our live webinar, the 12-week fast track, we're starting on February 2 for that, the next cycle. The 12-week fast track live webinar every Tuesday is 30% off also. So if you need more information about this, we'll be posting this in our Facebook and also the website regarding discounts, everyone. So again, this is only until January 18 also. If you are in our email list, we will also email you about the discounts. So for more information, just visit our website. You can send us an email. Okay? All right. And we don't know really anymore when is going to be the next discount for this. Now, this is just our one way of helping all of our nurses and students, especially with the whole pandemic that's going on right now. Of course, our very beautiful jacket, everybody. So if you want to have a sweater, everybody, you can visit our merchandise website. It's also in the website, matusnursingreview.com. You can get, you can get this jacket. I think it's only like $30, everybody. Okay. All right. So okay, so now let's have our winner for last week, everyone. I think you know the winner last week. The winner last week was Angelica Masaoy. So she's the one who won our 90-day online access NCLEX review, everybody. Okay, so we will have the winner after this, so you can wait and find out if you won. So Angelica Masaoy, give a congratulations to her. Hopefully she will pass the NCLEX. Okay, so again, everybody, thank you very much for being here tonight. You're putting a lot of messages in the comment section. So later on, I'll be going over all of the comments and then I'll be responding to them. If in case you really need more information, send us a message, or also me and my staff can respond to you, either email or on the chat box also. Okay, so thank you very much, everybody. Keep commenting because I'll be reading them, and thank you for being grateful and thankful. And of course, next week we'll have another round of this Facebook live session, everybody. So again, thank you very much and have a nice night, everyone.